Opening an addiction treatment center in South Carolina means clearing a certificate of need before the state will even look at your license application. South Carolina is a certificate of need state, so you must prove the need for your services before the licensing process can begin. Here is what it takes to open a licensed addiction treatment center in South Carolina, from the certificate of need to licensing, fees, and applications. We cover the certificate of need, Regulation 69.3 licensing, the 3 state fees, and the 2 separate applications you will complete. In South Carolina, addiction treatment centers are called facilities for chemically dependent or addicted persons, and none may operate without a state license. Each state uses its own lingo. Knowing South Carolina's term helps you find the right regulations and applications. No person or organization may establish, operate, or market a facility in South Carolina without first obtaining a license from the department. Regulation 60-93 runs 67 pages of highly detailed requirements, specific down to window screens and the mandatory janitor's closet. The standards cover policies, staffing, records, admissions, medication management, fire safety, and physical plant. Read it closely, or pay the price later. Strict requirements and a lengthy approval timeline mean operators who start late lose months. Do your research and start early. Behave Health is an all-in-one app designed to support the clinical, administrative, and billing work of running a treatment center once you are licensed. The platform puts clinical work, administration, staff, admissions, alumni, and residents together, designed to reduce the tool sprawl new operators face. Treatment plans, billing, and insurance authorizations live in the same app, designed to keep the operation organized from day one. 4 requirements decide whether your South Carolina facility gets licensed. Let us walk through each one before you commit time and capital. Certificate of Need, Regulation 60-93, 3 state fees, and 2 applications. Miss one, and the process stalls. Requirement 1. Obtain a Certificate of Need. South Carolina requires a Certificate of Need from all applicants before it will consider any addiction treatment licensing application. The CON requirement is intended to promote cost containment and prevent unnecessary duplication of healthcare facilities and services. Requirement 2. Meet Regulation 60-93, the standards for licensing. Current licensing materials are maintained by the South Carolina Department of Public Health. The requirements are not optional. The standards reach physical plant specifics, including window screens and what goes in the mandatory janitor's closet. Requirement 3. Plan for 3 different types of state fees. South Carolina requires initial licensing fees for both residential and outpatient facilities, as most state programs do. On a build over $500,000. Plan inspection runs $2,500 plus $100 per additional $100,000, and the site inspection is $500. Requirement 4. Complete the correct licensing application. South Carolina uses one application for outpatient treatment and a separate one for residential programs, unlike states that use a single form. Each application needs proof of ownership, verification of the administrator's qualifications, an emergency evacuation plan, and a check for the licensing fee. The regulatory bar is high, but so is the demand for treatment across the state. South Carolina ranked 5th in the nation for the highest increases in overdose deaths in 2021. Synthetic opioids like fentanyl contributed to a 52% increase in overdose deaths in South Carolina during the height of the pandemic. Horry County reported the highest number of overall overdoses in the state, according to the South Carolina Department of Health and Environmental Control. Once you are licensed, Behave Health is designed to support the day-to-day work of running an evidence-based, results-focused treatment center. Clinical work, admissions, alumni, and resident management sit in one app designed to keep a new operation organized. Treatment plans, billing, and insurance authorizations are built in, designed to support the revenue side from your first admission. Behave Health can also help direct you to resources for licensing or accreditation through the Joint Commission or CARF. Stop guessing at South Carolina's CON and licensing maze. Book a 20-minute demo at behavehealth.com. See the all-in-one app built to run an addiction treatment center at behavehealth.com.